Good morning, everybody. From a very sort of damp and miserable Manchester at the moment, actually. I'm more than delighted, but actually feeling a bit like a fraud at the moment for being given this real privilege to speak to you and to open this conference, because I'm an aged medic towards the end of my career, and I've spent the last couple of weeks since Raj asked me to do this reflecting on what I could do maybe to contextualize the day for you. And so I'm going to attempt to use technology, which of course is not the strong point of Generation X folk like myself, but I'll have a go now. And I just want to draw your attention to a quote from Harry S. Truman. We live in a very unusual time in history at the moment, but like all times which are testing, there are opportunities which have been born from the challenges that we currently face. And I think as you go through and listen today, I think you should bear those things in mind. And what I would ideally like to do is to give you three key messages which I hope will act as a benchmark and a way of thinking about what you listen to today. And those three key messages, and I'm going to go into these in some detail, is that there's never really been a better time to work within the healthcare setting. And underpinning this, I believe, and I think I'll show you evidence of this, that the NHS is just a simply fabulous institution to start a career and to develop a career in. The second thing is that the way in which I learned as a medic in the 1980s and beyond is very different from how people are learning at the moment, and will be different from how people learn in the future. And then the final thing I want to talk to you about is the area of work that I currently work in as Director of Global Engagement for Health Education England. I spend my time working within a global context, and I'm going to make a little argument for you to think about that you can't really deliver locally to a population without learning on a global setting. So let's think about the NHS for a minute. We're currently experiencing an aging population. We have 2.8 million people currently registered with diabetes, and this is rising exponentially. Male obesity, not just in adults but also in children, is rising. There is a level of complex morbidity that we have never seen, and the reason for this in large part is because mortality is slowing. So people are getting older, and because they're getting older, they've got more disease, more of a disease basket to cope with. To add to all of this, and I'm sure you've read this in the press, the UK has at least vacancies for some 40,000 nurses and probably about 15 to 20,000 doctor vacancies. And we are approaching a winter after what has been the single biggest health event in any of our lifetimes, COVID-19. But we are not alone. If you read the reports from the World Health Organization, they will tell us that we have to increase our workforce by some 12 to 15 million healthcare workers by 2035. And the Indian Skills Council very recently suggested that they were some 3.5 million healthcare workers short if they were going to meet the current demand by 2022. So going back to the NHS, why do I think it's so fantastic? Well, it was founded in 1948. It currently spends about 130 billion UK pounds and has 1.4 million people in its workforce. There are 154 acute hospitals, 56 mental health trusts, 7,800 GP practices. That equates to about 150,000 doctors and about 320,000 nurses. It sees 1 million people every 19 hours, which is quite extraordinary. But the underpinning issue for me about the NHS is the whole principle that healthcare should not disadvantage you because you are unlucky enough to be sick, ill, or require input from health professionals. What is quite important to bear in mind today, however, is that healthcare is not just delivered by doctors and nurses. There are at least 170 professional groups who are responsible for ensuring that our NHS delivers care at the point of contact. And these vary from the laboratory scientists all the way through to the logistics people that keep hospitals up and running. Not only is the NHS a phenomenal institution, but it's also remarkably cheap, despite perhaps what some of the newspapers would say. Our health spend in the UK is 8.46% of our GDP, and when we compare this to our European neighbours and to the United States, we actually get it very cheap. And in addition to that, and again, despite what you may read in the newspaper, the satisfaction rates are consistently high, and it's ranked #1 for many of the performance matrix of universal healthcare across the world. Now, why is this relevant to you? Well, the reality is that you wouldn't have joined this conversation and this call unless you were thinking about a health career. And the reality is that people listening to this call today will be the solution to the health challenges of the future. And whether that be because they improve and work out methods of increasing the supply of healthcare workers to deliver universal health coverage across the world, whether they learn how to upskill themselves and others to deliver in accordance with the demands of local people, whether they join new roles, become health navigators, health coaches, whether they discover new ways of working in order to improve healthcare, or whether you become leaders, you could be and probably will be the reason why healthcare improves in the future. So the NHS, we are the universal health coverage system experts. We're the oldest and largest universal health coverage system in the world. We also, and I would argue this very strongly, train the best value for money health professionals in the world. We don't always train the best in every field, and we don't always train the cheapest. But when you multiply best by cheapest, we're a long way ahead of most of our competitors. In addition to that, our altruistic streak within the NHS is very impressive, and we are still committed to spending 0.7% of our GDP on international aid, and much of that is focused on delivering universal health coverage to those who need it across the world. We do, however, need to recruit the best, the brightest, the hardest working, and those with the right skills and attributes. My second message is that learning for the future is not the same as learning now. And I was looking through some of my old slides when I was a medical educationalist some years ago, and I came across this one. And this is just to try and get a message across to you. Prior to the 17th century and the Industrial Revolution, if you thought about psychosis, most people thought that the people who suffered from a psychosis were possessed by a spirit. Moving through the Industrial Revolution up until relatively recently, people who had a psychosis were seen to be deviants. And nowadays, and certainly over the last 30 or 40 years, we've seen psychosis as a medical illness. Now, if you think about that, the disease is exactly the same, but how you look at that disease actually affects how you might manage it and treat it. Spiritual possession clearly makes visible people who are possessed, and it creates a role for spiritual healers in religious institutions. Deviancy, on the other hand, makes visible deviants and criminals, and creates a role for judges and jailers and courts and prisons. Whereas medical illness obviously makes visible mentally ill individuals and creates a role for psychiatrists in hospitals. But the same disease, and that evolution and enlightenment continues now. And we know that being possessed isn't the same as being deviant, is not the same as being mentally ill. Being a spiritual healer is not the same as being a jailer, is not the same as a psychiatrist. And it continues today. So when I graduated in the 80s, we referred to our clients as patients. If they weren't sick, there were no worries. and the population themselves had little healthcare knowledge. Nowadays, we are trying to create a sweeping cultural behaviour change, which gives our population the responsibility for staying well by improving their understanding of their own health and well-being. There's also a massive access to knowledge, so the availability of knowledge is no longer an issue. And there is also, quite rightly, an enlightened right to personal care. This changes the role of the health professional from a diagnostic and paternal individual who might be curing the problem into somebody who advocates for our population through the assimilation of knowledge to help them. They develop individual relationships with clients and focuses on prevention, health and well-being rather than treatment. And finally, on this point, and this is the key message for me today, this is what I call the educational wheel. And we, Generation X folk like myself, have for a long period of time focused very, very much on learning skills and learning knowledge. But actually, the skills and knowledge that I learned in the 1980s and early 1990s are utterly irrelevant for the care which I'm required to give as a surgeon in 2020. What I did start to learn was the inner ring of this in 1980s. So these skills called metacognitive skills, things like emotional intelligence, leadership, cultural competence, resilience, flexibility, adaptability, and communication. The only way that we can future-proof ourselves so that we can respond to the health needs of our population in 5, 10, 20, and 30 years is by developing these skills in ourselves. So as you're going through today, what you shouldn't be looking at is where you are going to learn stuff. But where you should be looking is what careers can I follow in order that I might modify my behaviour so that I can become adaptable to treat whatever comes my way over the next 20 or 30 years. Finally, you can't really deliver these days without considering the planet. I'm going to go back to real basics here. There are three building blocks of learning. The first is curriculum, in other words, what we learn. The second is who teaches us. And the third is the environment in which we learn it. And most of our courses, and certainly secondary education and university courses, are very heavily focused on curriculum, what we learn. But in the health professions, actually what we learn is nowhere near as important as to how we behave, how we interact, how we think, how we solve problems, how we manage risk. And these things are learned through role modeling and being placed in an environment which maximizes that learning. One of the big risks, I think, for future education is that we become very introspective and we believe that all we need to learn is what people have done over the last 10 to 20 years. I would argue, and certainly there is a discourse at the moment within government and within the NHS, that in order to develop those meta skills that I talked about before, we have to recognise that our real learning environment is the world and not a hospital or not a GP practice. So if we place our healthcare staff within the global context, we send them or give them opportunities to work on healthcare capacity building in low and middle income countries. We know that that improves their productivity. It increases the likelihood that they will come into the profession in the first place. It satisfies the younger generation's desire to understand about the globe. It's increasing in demand across our population. And as I said, it helps us develop those meta skills, which make us resilient and adaptable to whatever we face in the future. My own organisation, Health Education England, is responsible to Parliament for the quality of the NHS workforce. My own unit, the Global Engagement Unit, was only started 2.5 years ago because we recognised this issue of global education and how important it is in order to create the best possible healthcare workers for the future. And my own team has gone from 2 people back in October 1997 to over 100 people by October this year. And we're focused on 3 key outputs, which is to use our knowledge of universal health coverage to help other countries develop their own systems of universal health coverage, attract a global health workforce into the NHS by making the NHS the most attractive universal health coverage system in the world, and offer as many global opportunities as we can for the NHS workforce to improve their metacognitive skills. The principles that guide this work have been heavily influenced by today's younger generations. We cannot anymore, as an NHS, expect other countries to donate individuals to us to help us run our system because we don't train enough. So all of the programs that I'm involved in at the moment have transparent and evident co-development. In other words, there is mutual benefit for ourselves and any of our international partners. Everything must be done ethically, and I'm going to come on to that in a short while, and of the highest possible quality. And of course, the whole tenet of modern day healthcare is that we must be evidence-based and no longer go on anecdotes, and any relationships that we develop globally must be sustainable. The basis on which my unit operates is by generating healthcare partnerships across the world. We currently work in 26 countries across the world, ranging from India and the Southeast ASEAN bloc to South America and through to East and South Africa. And we have established a whole series of partnerships which allow our healthcare staff to work within a global context, to understand the challenges of the globe and to respond to any global problems that may occur using a global lens rather than a local lens. So to finish off, because I recognise that we're already quite a long way behind time, I just want to finish with 3 thoughts. So the first is that changes in learner expectations, the expectation that you have and the need for meta-skill development and the worldwide healthcare shortage require bilateral and multilateral international partnerships based on opening clinical learning environments to global learners. And that is the future of your learning. And then a quote from Tedros, who is the Director General of the World Health Organization. And this really is something which should ring true for you today. The world is full of frameworks, roadmaps, and action plans that sit on shelves collecting dust and never make a difference to people. I urge you, starting now, to translate your good intentions into concrete actions that transform the health of your people. So I am extremely grateful to all of you who have shown so much enthusiasm to join today. I'm also extremely grateful for Raj and the team to have the insight in such a difficult time for the globe to put on such a magnificent day. So I wish you all the very best, and I look forward to meeting many of you in your future groundbreaking careers. Much indeed.